Hi, and welcome to this video for babies with brachycephaly. My name is Sam, and I'm a pediatric physiotherapist with Alberta Health Services. This video is one video in a series about your baby's head shape and neck movement. This video is for babies with brachycephaly, which is a flat spot on the entire back of your baby's head. There's a separate video for babies with plagiocephaly, which is a flat spot on one side of the back of your baby's head. In each of these videos, we'll go over some things that you can do to help your baby's head shape. If you've noticed head shape changes in your baby, talk with your doctor and a pediatric physiotherapist. They'll check to see if there's anything that you might need help with to improve your baby's head shape. Your baby will have better results when changes to head shape are noticed early and treatment is started right away. Many of the ways that we help babies with their head shape are simple and things that you can do at home. It's going to take time to see changes in your baby's head shape once you start using the positioning strategies. It will take longer to see changes in your baby's head shape if your baby is older or if they have larger head shape differences. First, let's talk about what you can do to help your baby while they are sleeping. We know that there is pressure against the back of your baby's head when they're sleeping on their back, and this is okay. This is the safest way for your baby to sleep to prevent sudden infant death syndrome, or SIDS. Your baby should sleep on their back every sleep. What you can do is avoid having your baby sleep looking straight up all the time. Keeping their head straight or looking straight up puts more pressure on the back of your baby's head. To avoid this, set up everything when you're putting your baby down to sleep to encourage them to turn their head to the side. Put your baby into the crib so that their head is at one end of the crib one night and the other end of the crib the next night. This encourages them to turn their head both to the left and right sides because they'll typically want to look out into the room towards the door. Move overhead hanging mobiles and toys to the side if you use them or remove them completely. Gently turn your baby's head to the side when you check on your baby. You don't need to wake up in the middle of the night to change your baby's head position. Doing this when you're checking on your baby as you're ready to go to sleep will be often enough. Take any pillows or positioning devices out of the crib while your baby is sleeping. These are not safe to use when your baby is sleeping. Lying flat is best. Take your baby out of the car seat when you're not in the car, even if they're sleeping. Don't let your baby sleep in a bouncy seat or a swing unless your doctor has advised you to do so. Always make sure to place your baby on a firm, flat surface for sleeping. Most of the things you can do to help your baby improve their head shape will be done when your baby is awake. Here are some positions we suggest you add into your day. We are going to talk a little more about how to try all of these positions with your baby. Tummy time is one of the simplest and most important things you can do to improve your baby's head shape. It takes pressure off the back of your baby's head, and it is the best way for your baby to get stronger. Tummy time helps with both their head and neck control. It helps with all other movement skills your baby is learning in their first year as well. Skills like rolling, sitting, crawling, and using their arms and hands. Add tummy time into your day by trying each of these positions at different times. Even a short time on their tummy helps your baby get stronger. The four main tummy time positions are tummy to tummy with you leaning back, tummy time over your lap, carrying baby on their tummy, and traditional tummy time on the floor. Tummy time on the floor provides your baby with the most strengthening because they are the most free to move. Spend time playing with your baby in tummy time on the floor every day. Small amounts of time more often through the day add up quickly. We recommend that you try to reach a total of 1 hour a day of tummy time by the time your baby is 3 months old. Every time you put your baby down, try to put them down on their tummy first. To help your baby feel more comfortable while they're on their tummy, give them a little extra support under their chest. You can use a rolled up towel or blanket if they're struggling with tummy time at first. Tummy time is one of the best times to play with your baby. Use all your baby's senses. Use their ears, sing, or talk with your baby, even if you're not a good singer. You can also use toys that make interesting noises. Use their eyes, get face to face, be silly, use a mirror. Show them things with high contrast or bright colors, or move toys around to catch their eye. Use their sense of touch. Give them interesting things to feel with their hands. You can touch their face gently with your hand, or use a soft blanket to play peekaboo. Another great position if your baby has brachycephaly is lying on their side. Try using a pillow or a rolled up blanket behind your baby's shoulder and hip to help them stay in this position. Only use this position during awake or playtime. A firm surface under the side of their head is better, but babies don't always tolerate lying on a hard floor. If you have a soft blanket for them to lie on, you can use a thin child's hardcover book just under the head while their body is on a softer surface. This helps keep that nice firm pressure on the side of the head to help even out your baby's head shape. Have your baby spend time lying on both sides to help reshape your baby's head. We recommend side lying for a total of 1 hour a day if your baby has problems with their head shape. Try to carry your baby so the back of their head isn't resting against you. Try using a baby wrap or sling to help keep your hands free while carrying your baby, rather than using a baby container. This is sometimes called baby wearing. Once your baby can sit up, this is another great position for them to play in. Your first choice should always be sitting up on their own out of seating devices. If you're using a seating device, upright seats are better for your baby's head shape than baby containers, where your baby leans their head against a headrest, like in a baby swing. As much as you want to keep your baby in some of these new positions, there will be times when your baby needs to spend time on their back. Try to arrange the room and toys so that your baby wants to look to the sides rather than straight up. When you're playing with your baby, stay to one side of them rather than leaning directly over them. This will encourage them to turn their head to the side. Make sure your baby gets time looking both ways. Once you've been trying all of these different positions consistently throughout the day, how will you know if your baby's head shape is getting better? After you've given baby their bath, when their hair is wet and smoothed down, take pictures from the top, front, back, and both sides. Take these pictures every month to track your baby's progress. Be patient and keep working with the positioning tips. Correcting your baby's head shape will take time. When you see your baby every day, it can be really hard to notice changes. These pictures will help you see even small changes over time. It takes time to see change in your baby's head shape once you start using these positioning tips. It's going to take longer to see changes if your baby is older or they have bigger head shape differences. Some babies who have problems with their head shape also have problems with their neck movement. Babies with brachycephaly who have a flat spot on the entire back of their head that maybe is more to one side than the other might also have problems moving their neck fully. If you think this is what's happening with your baby, watch the video Torticollis, neck stiffness, for more information on how you can help your baby with their neck movement. Also, make sure to talk to a doctor and a pediatric physiotherapist about your concerns. Your baby may need other types of treatment if your baby is older than 5 months old and you've been working with physiotherapy and doing positioning consistently for 2 months and haven't seen any change. If your baby has larger head shape differences, or if your doctor recommends other treatment. The most common treatment option for older babies or babies with bigger head shape changes are cranial remolding helmets or baby helmets. These baby helmets are made for your baby by a trained specialist called an orthotist. These helmets are usually worn for 20 to 23 hours a day for 3 to 5 months. How long your baby needs to wear this helmet will depend on how your baby is doing. Your doctor can help you decide whether a baby helmet is a good option for your baby. In this video, we talk about positioning for babies with brachycephaly, a flat spot in the center of the back of the head. There's another video that talks about positioning for babies with plagiocephaly, which is a flat spot on one side of the back of the head. The last video in this series is about torticollis, or neck stiffness, and how that might affect your baby's head shape. We hope that this video gave you some ideas of ways that you can use your baby's position to help with their head shape. Remember, if you are worried or have questions, reach out to your doctor or a pediatric physiotherapist for more one-to-one help.